Welcome to Patient Assistance Tool, PAT Wizards. This is what the PAT screen looks like. Under the Educational button, you can access these interviewing wizards in an acute consultation. They're also, of course, incorporated in the chronic disease management. What wizards are there? Smoking, weight, exercise, a biopsychosocial approach to chronic pain, and emotional reactions to starting insulin. The 5A approach is facilitated. The wizards will ask and assess, and of course leaving it up to the doctor to advise, assist and arrange follow-up. The patient self-assesses their state of change. An ABCD approach to CBT is used in some of the wizards. A standing for the activating events such as starting insulin. B is a belief system such as I'm scared that it will cause pain or cause me to have hypos. C is a consequent emotional response such as I'm scared, I'm fearful. And D is a disputing belief, which is, yes, well, if you're a non-insulin dependent diabetic, we're only going to use a small dose of insulin and hypos are very, very unlikely. Motivational interviewing. The guts of motivational interviewing is that I understand what I have to do as I hear myself say it, not as the doctor says it, not as the nurse says it, but as I say it or as I think it. So, turn the monitor to bridge with the patient so that they can see that. Give them the mouse, make sure they're comfortable with using a mouse, most people are, and let them do most of the work in the acute consultation. Yes, you can prompt and ask questions as you wish. So let's have a look at some of these. Okay, we'll have a look at the chronic pain wizard first. The first screen in the chronic pain wizard offers a definition of chronic pain and a rationale about why we're going to do a complete evaluation. First of all, we assess a healthy lifestyle. The ones that the patient is already doing, when they click on, they turn to orange. The ones that they are not currently doing will summate at the end, and so the doctor knows what they are not doing. Next, this is a cognitive approach. They're also called yellow flags, but we've converted them to CBT. And so we're going to have a look at belief patterns. In this particular case, pain has taken over my life and the pain is harmful. So this is the B of the CBT approach. And the computer program will automatically offer a D, which is a disputing belief, and it is appropriate at this particular point in the acute consultation to go through this with the patient. Next, we check on the C, which is a consequent emotional response. And so, once again, you would expand upon this during the consultation. So that patient before would feel anxious or worried. And then we're going to have a look at what's going on in this person's life. In this particular case, they have mentioned work situation and financial matters, and once again you would expand upon those. The patient is then asked to make a choice about what they want to do, and this summates at the end. If you click on copy all and then right click on paste, it drops into your ordinary acute records. Doesn't matter what program you're using. Next, have a look at the exercise wizard. It asks a number of questions because we're looking at why does this patient not exercise? Is it just lack of knowledge in this particular situation? And next we're trying to increase the motivation. So there's a screen with all the positive benefits of exercise, and these change to blue when they pick on the ones that are relevant to them. So what you're going to get at the end is that in this particular case there was a lack of opportunity and a lack of benefit, but there are some motivating things, and yes, they have nominated what state of change they're at. Next, let's have a look at the cognitive therapy insulin wizard. This looks at the emotional reaction to starting insulin. In this particular case, the patient is annoyed and also feeling worried or anxious. So this is the C, or the consequent feeling. And next we're chasing the B, which is a belief pattern, And so fearful, it's going to be painful, and so we're asking the patient to have some insight. Then this is the D, which is the disputing belief for the fear. Okay, so these are some of the common concerns, and these are the facts that you can discuss with them. And once again, it summarises and can be copied into your ordinary records. This next one is the smoking one, and we have, first of all, we have a simple decisional what are the likes and what are the dislikes. Next, we have the smoke screen figure, which summarises all the negative effects of cigarette smoking. So we're looking for extra leverage, such as macular degeneration, osteoporosis, which they may not have heard of. And at the end of that, there is a state of change thing, and once again, copy into the ordinary notes. Here we have a CBT wizard into weight, and so we're looking at what are the belief patterns behind people, and this is how it starts. This is a cognitive approach to weight. Now, with the TV programs, Biggest Fattest Loser, often we have Fast and Furious. So we have a disputing belief that yes, rapid intake of calories, rapid loss of calories can reduce metabolic rate. Then there are a couple of more screens, and then we ask the patient to nominate what they want. And so there's some